Hey Elias, I got that C color you asked for. What's going on?
Yes, sir, James. So we got Mr. David Jones. He was in a motor vehicle accident. He has a suspected spinal injury.
Okay. So you want to go ahead and put this on there?
Yes, sir.
All right. You got it?
Yep.
All right. All right. Okay. Secured.
Hey man, what's going on with my brother?
Hey sir, are you his relative?
Yeah, this is my brother. I heard he was in some kind of accident. Like, what's going on?
Yes. Let's talk about it. Let me have you take a seat. Hey brother, my name's James. I'm one of the nurses helping out your brother today. He was in a motor vehicle accident, and we're doing our best to stabilize him the best we can right now.
Okay. Well, what's this on his neck? Like, what's that doing to him?
So that's a cervical collar, and we put that on there to stabilize his spine, so that way he doesn't have any spinal cord injuries, which could potentially lead to paralysis or death.
Okay.
So we want to make sure that that's as still as possible. I did want to ask, did he have any medical history or any other issues that you're aware of?
All I know, man, is he's had a lot of problems with his heart, like recently, and he smokes like 2 packs a day. That's all I know.
Okay. All right. Well, thank you. Man, I'm glad we got him stabilized for the most part.
Yeah, for sure, man. Especially after the fact that his brother said that he had heart condition and he was smoking about 2 packs of cigarettes per day. I mean, something we got to think about. The possibility of was, what if he had a stroke or a heart attack, and that may have caused the crash.
Yeah, it's pretty rough. Well, I guess all we can do is just monitor and make sure that we keep an ear out for X-ray and CT, so that way we can clear that C collar.
For sure. Hello, sir. I'm just coming in because I noticed his O2 saturation was dropping, so we're gonna see what's going on.
Okay.
Hey, Elias, what's going on? I see his sats are going down. What, do you need help with anything?
Yeah, man. So I'm gonna set up this bag valve mask. I'm gonna try to bring up his O2 sats and lower his respirations.
Okay.
What was that y'all were just doing to my brother?
Yeah, so what we did is we got a bag valve mask, and what it does, it delivers positive pressure because he was having insufficient oxygen or insufficient breath, so we had to get his oxygen saturation up because it was down.
Hey, Elias. So his sats are starting to go up, but his heart rate seems a little erratic. What do you want to do about that?
I mean, I agree. So what I'm gonna do is I'm gonna grab the AED just in case, okay?
Okay.
So what's an AED? Like, what are y'all doing?
Yeah, so what AED is we're gonna place it on your brother if we need to do so, and it's gonna analyze his heart rhythm. And what it does, if it needs to be used, then of course it'll be used, and it's gonna reestablish a rhythm that's gonna be normal and of course sustainable. Okay. Hey James, we got the AED right here. We're gonna go ahead and set it up, right? Cool.
Apply pads to patient's bare chest. Plug in pads connector next to flashing light. Shock advised. Charging. Stay clear of patient.
All clear?
Deliver shock now. Press the orange button now. Shock delivered. Pause. If needed, begin CPR.
All right, brother. We're gonna do CPR.
Alright, let's do it. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30.
All right, 2 breaths. 1, 2. Okay.
2, 3. Appreciate your help, James. The patient is definitely stable now, man. His heart rate's better, O2 sats are better. Everything's looking pretty stable and good. We'll just continue to closely monitor him and make sure that that doesn't happen again. But of course, we just gotta be prepared for everything. But yeah, we'll monitor him closely.
Yeah, I'll make sure I go notify the providers. We'll get him where he needs to be.
Sounds good.
So I saw y'all doing CPR on him. Like, why were y'all doing that?
So what was happening is that his heart was not beating at a rhythm or in a rhythm that was allowing the circulation to go through his body efficiently. So what we were doing was the chest compressions to facilitate the blood flow as if the heart was pumping normally, so that way he could get blood to his brain. And also we were using the bag valve mask to facilitate those breaths, so that way the blood would also be oxygenated. Couple that with the AED, it was able to monitor and recognize that rhythm as a shockable rhythm, so that way it was able to fix it, to kind of restart the heart in a way, so that way it would take back over and continue the regular heartbeats in a normal way, so that way he could sustain his life.
Okay. Yeah, it just seemed like there was a whole bunch going on.
Oh yeah, there definitely was, but he seems to be doing a lot better now. He's got a more of a normal rhythm. He's breathing a lot better. So we're just going to continue to monitor and hope that he improves even more.
Thank y'all for everything that you did for my brother.
No problem.